there, Dr. Jennifer Smith here. If the communication in your office is not always respectful, feels confrontational at times, or is just inconsistent based on moods, this video is for you. Learn how to reduce drama and up the cooperation by defining your office communication rules. Now, if you are a woman who is a dentist or a dental specialist, make sure you subscribe to this channel and ring that bell. We make content by women for women, new stuff coming out every Tuesday. Now, within my office, we get comments constantly by patients coming in, sales reps, parents, other dental specialists and dentists, that the way we speak to each other is unique. We are unusually polite and everybody feels it. Now, those are the communication rules in action. Today, I'm going to cover the 8 rules that we follow in our office. Now, these rules that we've established are written down, they're in our staff room, they're actually in a few places in the office, and we talk about them all the time. Let's cover them. Rule number 1. Speak very politely using a person's name, please and thank you as a minimum. Now, I think this is why we get so many comments in the office about how much we must like each other, because we are very overtly polite to one another and to all of our patients at all times. I'm telling you, it makes a huge difference. If you were to listen to me chairside with one of my assistants, it might sound something like, "Thank you, Jane, for passing me that mirror. You're welcome, Dr. Jen." And that's for every single interaction that we have. Rule number 2. When you talk about a person who is not present, you must speak as if they are listening to you and use their name in every sentence in which you refer to them. This prevents talk about other people, so team members, patients, etc., from turning into a complaint fest about that person or a situation. So if a patient just hung up on the phone with my receptionist and it was not a fantastic interaction, if she wanted to talk to me about it, she would have to talk to me about it as if that patient was standing next to her and listening in on the conversation. That completely changes how we solve the problem that may have occurred and how future interactions will go. Number 3, if you have a problem with someone, you must talk to them about that problem and only with them and in private. That means that everyone on my team is responsible that if they identify an issue they are having with someone, they must speak only to that person about it. That means no one comes to me with problems about other people. Yay. Number 4, apologize and make restitution if someone is upset by your actions. Now, we talk in our office a lot about how apologizing doesn't mean that they were right and you were wrong. An apology is simply a way to make someone feel better when you did something that upset them, and there is nothing wrong with that ever. Now, do you have communication rules in your office? Make a comment in the comment section below. Let me know what those rules are. I always love to see what other people are doing. Number 5, greet and farewell everyone by name with eye contact and a touch. Now, in our office, that means every morning when everyone arrives, we all say hello to each person individually with their name, and we look at them and we do high fives in our office because that's what we all agreed worked for everybody. Some people are more touchy than others, and that seems to be the consensus. That also means when we leave at the end of the day, we do the exact same thing. It means we always all know who is present, we all know when everyone has left, and we have a chance to give each other a warm smile at the beginning and the end of the day, and that sure makes all of us feel pretty fantastic. Number 6, blame a system, not a person. This may be my very favorite rule. When something doesn't go right, it does not matter what it is. The rule in our office is that you must first identify the system that may have been the failure. More often than not, when mistakes happen, it is not intentional. People are not trying to sabotage you or your day or your patients. If you can identify the system that failed, you can fix that system, and then you don't have to blame a person. Usually it simply means that some training has to happen. Number 7, you need to tell the truth about all things. Lies, white lies, exaggerations, none of those things are okay. If we're talking about anything that has to do with the office, our patients, any of our interactions, it must be 100% truthful at all times. And number 8, we must always use positive conversation. Now that's easy to say. Let me give you a quick example of how that might be implemented. So let's say, similar to my example before, someone gets off the phone and they just had a very difficult conversation with a parent. We all know these things happen. If they were to come to me with a discussion about that conversation, or even if they were going to talk to anybody about that conversation, they must use positive conversation. So it is not okay to say, "Oh, I just talked to so-and-so again. He was so mean on the phone. Why is he always so grumpy? He's in such a bad mood. He just ruins my day every time I talk to him." Instead, it would have to be something along the lines of, "Oh, I just spoke to John on the phone. He was quite upset that he couldn't get the appointment time that he wanted. I found that conversation incredibly challenging. Does anyone have a suggestion for me on how I could have handled that better?" That flip can be quite difficult. It is challenging for most people, myself included. We work on it all the time, and it is one of the things we role play so that we all have some good examples on hand of how we can do that. Now, I hope that those 8 rules are helpful to you. By no means are they rules that everyone should necessarily have in place, but I can tell you they've completely changed the culture of my office, the feeling of the office, the way we communicate with each other, and we are all much happier for it. Now, I've linked down below in the description a link to my website, which will take you to a place where there is a free PDF called Your Business Health Checklist that can help you identify where your practice is at right now, and if maybe implementing something like these rules would be a good idea. Also a link to my website. There are other resources there as well. Don't forget to subscribe to this channel. Make sure you like this video and leave me a comment down below. I can't wait to see you next time. Bye-bye.